Allison, around medication safety. Were you able to see, again, reduced dosing errors and a reduction in severe hypoglycemic events? Was there ever any translation into cost savings, or were you able to compare your performance to other institutions within your system that don't use EndoTool?
We have been able to compare between us and one other hospital in our system that is not using EndoTool. And we did notably see a decrease in hypoglycemic events, shortened time to resolution, specifically DKA. We didn't have specific numbers. We've had EndoTool at our location for over a decade now. So most of our data is kind of with use of EndoTool, and we've kind of recently merged into our system-based model. So don't have as many data compared to our other health centers yet. But certainly we're seeing cost avoidance by avoiding those hypoglycemic events, and I think improved efficacy, reducing any dose deviations. Really, our providers do not have the need to utilize any sort of dose deviation, which EndoTool certainly does allow providers to make their own adjustment at any time, and we make sure to provide extensive education and ongoing education as we're seeing new clinicians join. But for the most part, we're able to just continue with all of the straightforward dose recommendations coming right from EndoTool.
Do you have conversations with other pharmacy leaders in your system that are not using EndoTool, and have you given them any advice and help them make a case to expand in their facilities?
I know some other sites are interested. We have given advice to, we're also in the process of expanding our EHR. I think one of the key pieces of advice would be getting stakeholders in each area to kind of champion it. You need a physician champion, certainly a medical director who's going to be very familiar, someone from pharmacy to help with the operational aspects, and also can then help take over some medication safety if you don't have a designated medication safety officer. And then, of course, nursing. They're going to be hopefully the biggest champions. Like I said, we're spoiled. We've had it for so long. We have so many people who don't even know what life is like without EndoTool. But I think that would be having a strong multidisciplinary group of stakeholders to implement the rollout and get buy-in from all of your different clinician groups would be very important.
And we talked about nursing workflow. Has this impacted pharmacy workflow at your institution? Again, it's been there so long, it's probably hard for you to quantitate the improvement, but it probably does have an impact on your workflow, I would hope.
I would say relative to where I practiced without it, we got a lot of questions very frequently about the dosing recommendations, and I really never get questions because it's, again, so straightforward with EndoTool. We've implemented some aspects into the ordering process so that our pharmacists can actually help own steps and like inputting the order correctly into our EHR to ensure that it's safely entered. And if a physician were newer to using the application, they would have kind of a backup to make sure that they put like the right, we use a dose range for our order, which is not typical of other medications that you might be ordering within our EHR. I think those are probably the major differences for the day-to-day operations, but then of course from a med safety perspective, we're seeing those reduced overall hypoglycemia rate.
Do you do a deep dive into every severe hypoglycemic episode?
We do for everything that is reported, which we are, our goal of our institution is always to support every hypoglycemic event.
It'll be interesting to see too if there are fewer errors in treating IV insulin patients, what impact that would have on overall errors within the ICU. Melissa, I wonder if that's something you've thought about looking at, that now we have this tool that really reduces cognitive burden for nursing. They can be more attentive for other aspects of patient care, and may that have an impact on reducing medication errors?
We haven't particularly looked at reducing errors elsewhere. One of our challenges is trying to figure out how do we catch errors without having to rely on folks just reporting, because we know that not every error is reported. But I think that what we have seen is that, like others mentioned, the the cognitive burden around trying to use a paper protocol is significant. And so being able to remove that from the nursing staff in the CSICU has been very helpful. They notice that, I mean, there's a lot of satisfaction. They're able to talk about all of the other things that they can manage in this really complex post-cardiac surgery patient panel, that they honestly really need that extra ability, that extra brain space to be able to manage all of those extra drips and lines and tubes that we always talk about in our ICUs.
And, and investigating all those errors also takes a good bit of time, and time is money as well. Scott, from a pharmacy standpoint, anything you'd like to add from Beacon Health that came into play when you were making decisions for expansion?
No, I mean, I would echo basically the same experience that has already been talked about. I mean, just the ease with which these infusions can be administered right now, and from I think a pharmacy verification standpoint, they have even an eased cognitive burden in making sure that these insulin infusions are managed appropriately. So not a whole lot else to add. I mean, it's been a positive experience across the board with every discipline that's touched by EndoTool.